That's fine.
Dr. Heiss, great to speak with you. I'm excited to kind of share your story and hear, where you're at the beginning of this engagement and all the incredible progress you've made. For starters, would love to hear, just a brief introduction, kind of your name, your specialty, your current role, and where you're practicing today.
Yeah. My name is Dr. Jim Heiss. I'm an internal medicine doctor by training. I worked as a hospitalist. Been doing this for about 20 years. Maybe over the last 10 or so, I've been combining roles of hospital medicine and chief medical officer. And just over the last 2 years, have devoted most of my time to administrative work. Um, so, yeah, I forget what the rest of your question was.
Yeah, CMO, taking care of business
Yeah,
in
yeah.
in Wisconsin.
Oh, that's right. That's right. Currently, I live in Door County, Wisconsin. We refer to it as a county because that's sort of what it's known. It's a tourist area. It's sort of the thumb that sticks out into the waters of Lake Michigan and the Bay of Green Bay. And so, great place to live, great place to work.
It's great. And thinking back, and I think your coaching engagement began in March or April, 5 or 6 months ago. Um,
Mhm.
what did life look like for you? What were the challenges that you were facing, both in your life as a CMO and a leader and a physician, and in your personal life?
Yeah, I guess the biggest challenge, not so much personal life, but professionally, I've been in leadership for quite a long time, but was really wanting to do the best work I could, and was sort of feeling maybe a little bit less than, a little bit like, uh, other folks on my fellow senior leaders were seemingly on top of things a little better than I was, and so maybe a little of imposter syndrome crept in there.
Sure.
But I just decided that, in order to sort of maximize my professional satisfaction and happiness, it was time to get a coach. I sort of looked at it as, you have Michael Jordan and other sports figures; they have coaches and rely on them. So why not a physician? So that's kind of where I proceeded.
Yeah. And I think that imposter syndrome you brought up, or that feeling of inadequacy is, or just a little, that emotion, it resonates with a lot of doctors and a lot of physicians
Right.
wondering, for you, why was that an important challenge to solve? What did that I guess prevent you from doing, or why was that an important challenge for you to step over?
I think for me, it was interfering with being as effective a leader as I could be. Also, just the pleasure in my work. I'm very fortunate in that this is the place I work at is the best place I've ever worked in my life, and my senior leadership team is wonderful. And I guess I wanted to do the best by myself and also the best for them. So it just seemed like it made complete sense to do it. And thankfully, it's been more than a good outcome.
That's incredible. Um, and I guess leading towards coaching there, how did you find MD Can Help, and what were your thoughts, anticipating and going into this process?
Really wasn't sure what to expect. Turned out one of my colleagues had experience with your mom and had been to a wellness retreat over on the East Coast a number of years back. I think it was pre-COVID. And so he had mentioned to me, he's actually my personal physician as well. So he had mentioned your mom and said, hey, she would be a good resource. And so I hadn't heard of MD Can Help until I Googled your mom and came upon your organization. And so his recommendation was spot on.
That's great. And I guess, you talked about, hey, professional athletes, high level physicians, like coaching is really important, but what were your emotions going into this? Was there any uncertainty, hey, what can a coach actually do to help me with, my day to day? I guess what were your thoughts leading up to this?
No, I didn't feel like. I mean, I kind of had a sense of what this was going to be. I didn't know in what mode it would be. Is it just someone that you can bounce ideas off of? Is it someone that digs a little deeper, which in fact is the case? So I was excited for the opportunity. I was very fortunate a number of years back, prior to COVID, to have a seasoned CMO as a bit of a mentor who
Yeah.
came to finish out his last year or two at our organization. So I had a coach in that sense, but this was different, much more robust, much more comprehensive.
Yeah. And you had a great experience with Dr. Sherman, one of our coaches on staff. And I'd love to hear a
Mm-hmm.
little bit about, what you two did together and then where you are now and the progress that you've noticed since the coaching.
He just has an amazing gift to actually, um, I guess, not to sound overly simplistic, but to hear what you're saying and to actually delve deeper and to find out what's beneath what you're saying. So if I said to him something like, I just feel like this is not enough, and he said, well, think of another time when you felt that way. What was that about? And so that was challenging to think about examples, but use that as a jumping off point. So really just help me think of things in a different and more in-depth way. And there were a couple of sessions where literally after the session, and I told him the next time we met, I said, that was a game changer. Just the sort of rethinking the way that I approached something was a real game changer. And I have to say it was amazing how, even that next day, it's like, God, I feel better about this. And I'm not a skeptic, but I always sort of, I'm like, it's going to take a while. And I was surprised at how beneficial it was quickly.
Wow. And when you talk about it being beneficial, and I guess, those short-term moments of, hey, I really see a difference here are incredible. And I guess in the longer term, what do you feel like is different about your day-to-day now with these new skills?
Well, I think to be more specific about it, I think, an example would be, and I'm sure this is not a unique feeling, but you're in a meeting and you talk in a meeting, and of course most people right away say, "Oh God, did I sound okay? How did I think I sounded?" And then other people seemed like they were poised and were more prepared, and you sort of ask yourself, why can't I be that way? And with Dr. Sherman's help, it was a matter of, hey, you have your gifts. Just because they're not the same as yours doesn't mean that that person is any different. They wouldn't be able to do what you did. And even though it seems kind of commonsensical, when you're actually working in a coaching relationship, it really makes a lot of difference.
Yeah. So it sounds like you're now, and I guess I'll make it more as an open-ended question. What are you able to do now that you weren't
Yeah.
really able to do before?
I think the ability to be much more present in meetings is big, so rather than thinking about, comparing myself internally or beating myself up, just, bringing what I have to bear and recognizing that we all have our individual talents and our individual areas of ability. And it makes you a lot more present, and it makes you able to participate in a more meaningful way because you aren't spending time listening to that background noise.
Yeah. And with that increased presence as a leader, and it's so powerful to be able to own your strengths and bring that presence to the table. And I'm really happy that we were able to do that for you. What,
Mm-hmm.
how does that make you a better CMO, a better physician? How does that benefit actually translate, to all the doctors and patients that you lead and serve today?
I think you recognize that each person has their own gifts, and rather than worrying about, gee, does this doctor like me, or I'm nervous about going to talk to this doctor because I don't think they like me very much. It doesn't matter. You're there to do the best job you can for the organization, and in my role as support for that physician. So it's made me a lot more comfortable in my day-to-day activities, and in the end, I come to work feeling a lot more, or I leave work rather feeling a lot more fulfilled, I would say,
Wow.
than previous.
It's incredible. It's incredible. Um, and my last question is just what would you tell a physician, a leader, at anyone who's watching this and um, is unsure about taking the next step?
I think something like this is the best investment in yourself that you can make. I mean, I'm fortunate in that I was able to get an MBA as well, and so I had that additional level of education. But it's not the same as what this is. This is really um, personal growth type education. And it's worth the investment in yourself, especially, thankfully I didn't come to this from a place of I want to leave medicine. Um, but I can only imagine that for those that are in that position, this would absolutely help the situation, because I think we all get hung up on how we think about something. And when you have someone else able to listen to you and reflect back what you're saying and what you're thinking, and being able to sort of say, wait a minute, I didn't think of this in this way. It's liberating.
Yeah. Yeah. Dr. Heiss, thank you so much for sharing your story. Really inspirational. And I think a lot of physicians will benefit from knowing that this change is possible, and that, they don't have to keep going at it alone, and that they can really, make some change. And to your point, that change can come pretty quickly. So thank you so much.
Absolutely.